Hi, my name is Derek Despot. In this video, I will be covering treatments, prevention, and control for influenza, as well as a few additional facts about the virus. As we have already learned, influenza, or more commonly known as the flu, is a virus. So, to be able to treat a virus, one would need to take an antiviral drug. Tamiflu or Relenza are two of the more common antivirals that doctors prescribe for the flu virus. If taken soon after you notice symptoms, these drugs may shorten your illness by a day or so and help prevent serious complications. The Centers for Disease Control and Prevention recommends annual flu vaccination for everyone over the age of 6 months. Each year's seasonal flu vaccine contains protection from the 3 or 4 influenza viruses that are expected to be most common during that year's flu season. The vaccine is typically available as an injection or as a nasal spray. The quadrivalent flu vaccine protects against 2 influenza A viruses and 2 influenza B viruses. Common prevention techniques include washing your hands frequently and thoroughly throughout each day. Whenever you or another has the urge to sneeze or cough, try to cover or contain that urge. And lastly, try to avoid places with a lot of people, as exposure to other infected people may lead to your own infection. Now some additional facts. Here's an article for CDC's website about why they are forced to estimate the number of deaths related to influenza. CDC does not know exactly how many people die from seasonal flu each year. There are several reasons for this. First, states are not required to report individual seasonal flu cases or deaths of people older than 18 years of age to CDC. Second, seasonal influenza is infrequently listed on death certificates of people who die from flu-related complications. Third, many seasonal flu-related deaths occur 1 or 2 weeks after a person's initial infection, either because the person may develop a secondary bacterial co-infection, such as bacterial pneumonia, or because seasonal flu can aggravate an existing chronic illness, such as congestive heart failure or chronic obstructive pulmonary disease. Also, most people who die from seasonal flu-related complications are not tested for flu, or they seek medical care later than their illness when the seasonal influenza can no longer be detected from the respiratory samples. Sensitive influenza tests are only likely to detect influenza if performed within a week after onset of the illness. In addition, some commonly used tests to diagnose influenza in clinical settings are not highly sensitive and can provide false negative results. For these reasons, many flu-related deaths may not be recorded on death certificates. Like most diseases, young children, older adults, and younger people with weaker immune symptoms sometimes become sicker from the flu virus. This is also true if you have a condition such as heart failure and lung disease, asthma, or diabetes. Having the flu while you're pregnant increases the risk of premature labor and delivery. In 2003, there were 105 deaths of children related to this virus. You can pass the flu to others from 1 day before you have the symptoms up to 5 to 7 days after you get sick. Some people might be able to infect others even longer. And in the information section of this video, we have uploaded a link to show worldwide deaths related to the influenza virus. And hopefully that will give more insight as to how deadly this virus or infection is. So thank you for watching our video. Hope you enjoyed it.